All right. So this is the third episode of GOER questions, right? GOER clinical cases. Now I want to talk about one of my favorite biochemistry concepts ever. Oh, and I feel like this exam is going to have some interesting biochemistry questions. But it's the problem of hyperhomocysteinemia. Homocysteine. You have a lot of homocysteine in your blood. In your homocysteinemia. Homocysteinemia, right? Let's review homocysteine. Homocysteine. I hate the blue. Homocysteine, right? So homocysteine gives rise to. So the problem with it is that it accumulates in your blood if you don't metabolize it properly, and then it causes atherosclerosis. So if you get a case of a kid with atherosclerosis, you know what it is. It's homocysteine, right? And it kind of like points you in this direction. The other thing is they get lens dislocation. The dislocations are inward, right? They look like this, and they're really tall. That's the other thing. They have intellectual disability. That's the other thing, right? So it's kind of like Marfan's, except that you have increased risk of atherosclerosis in Marfan's. You have increased risk of what? You have increased risk of aorta damage and like aortic valve damage, stuff, prolapse, stuff like that. For this one, your main thing is atherosclerosis damage, right? But you're still tall. You have lenses that are inside and down dislocated, whereas in Marfan's you have outside and out, right? Outside and up. Okay. Uh, so what happens? Why does this happen? So there isn't. I like this is because it's a couple things could gives rise to this, right? A long list of things. So, but let's draw the. I usually draw this because it's something that can you can easily forget. I first draw homocysteine, right, and then it can lead to two things. So it can lead to cysteine, right? Obviously, it's homocysteine. It can break down to cysteine. You require vitamin B6 for this process, right? So if you have a vitamin B6 deficiency, you can develop hyperhomocysteinemia, right? It's the more rare one, right? More rare one is the B6. The more common one is vitamin B12 or B9 deficiency, or like some sort of a genetic defect that you don't have one of these enzymes. But the other kind of amino acid that homocysteine breaks down to is methionine, right? And then methionine uh, gets adenylated to SAM. This is major throwback for a lot of you, but SAM is used to remember the like norepinephrine, epinephrine, dopamine synthesis. SAM is the last enzyme, or is the cofactor for the last enzyme that changes norepinephrine to epinephrine, right? But and then SAM makes SAH, right? And this goes back to this. Now this step requires B12 and B9, right? And so this is really interesting. This pathway is required for methylation things. What is methylation? Methylation is like a carbon group with like three hydrogens, right? So this pathway adds carbon to things. So it's really important for synthesizing stuff because it literally adds carbon. Nothing else can add carbon like this does, right? So methionine has basically one extra methyl group than homocysteine. So this is it methylates stuff here, methylation. If you remember, it was something else methylates stuff, and it's because it's kind of like part of these two things are like part of the methylation pathway, and that's folate, right? You have tetrahydrofolate, and then you have methylene tetrahydrofolate, stuff like that. So this is like your classic like folate B12 that you have like tetrahydrofolate, and then you have actually methylene tetrahydrofolate, and you have tetrahydrofolate. So and then vitamin B, this is B9 basically, right? B9, and then B12 is here. So uh, yeah. So basically, look at this pathway. If you have B12 deficiency, or if you have B9 deficiency, or if you have B6 deficiency, you can have this, right? Now, let's say if they give you, you can have hyperhomocysteinemia. If they give you a case, they're like, okay, this kid has hyperhomocysteinemia, right? And then you see, but they have, they have normal methionine, but they have low cysteine. Then what vitamin could help this, right? Think about it. So in this case, because they have normal methionine, these two guys are working normal. But if they have low cysteine, B6, you got to give them B6, right? Um, the other thing is, sometimes they're like, oh, you have high homocysteine. That means you either have B12 or B9 deficiencies. But then they give you like another clue that's like, oh, we have neuro issues. Then you're like, oh shit, it's B12. Or they say we don't have neuro issues. Oh, it's B9. Or they do the other chemical that accumulates. It's like methyl something something. Uh, but that one only accumulates when you have a B12 deficiency, not a B9 deficiency. So it kind of helps like you distinguish between all these. So know this like kind of cycle. Like I'm gonna highlight what's important is the homocysteine, and then leads to methionine, and then leads to what? Cysteine, and then B6 is here, B12 and B9 is for this one. So B12 and B9 is for this one, and then B6 is for this one, right? Okay, let's scroll down. All right. Next question or next case is old guy, has watery diarrhea, has had some weight loss for the past 5 years, uh, and then a biopsy of this guy's intestine shows macrophages within the lamina propria, and it tells you that they're PAS positive, right? What is this? This is what. So you may be like, oh, this is obviously Whipple disease or whatever. Oh, yeah, I know something with Whipple disease, but they can ask you a lot of things about like Whipple disease or whatever. First of all, you treat it with antibiotics, right? Second of all, it can produce right? So cardiac, okay, card, mm, can cardiac problems, auricular, your joint pain, neuro problems, neuro, right? In addition to all this, it can cause malabsorption. How does this happen? Basically, this is also important to know. So these are the villi, right? They have these lacteals in them that take the lymph and the fats that's absorbed down, right? So these macrophages come here. They're big and they have a lot of this Whipple bacteria in them, and they kind of block the lacteals, so the fats can't get absorbed. So the other histologic finding is that you see a lot of fat within these cells, right? They look like this. They literally look like they have like a bubble in them, right? Um, and I mentioned this earlier. The organism's name is Troplerima whipplei, something Whipple, right? The important thing is it's a gram-positive rod, right? Gram-positive rods are rare. Clisteria is one of them. This is one of them. Listeria is one of them. Uh, there's like one or two more. Oh, like Corynebacterium is one of them. I think this dysphoria is like the ones I remember. Maybe there's one more. But those bacteria, like rods are generally gram-negative, but except for those ones. All right. I'm gonna end this one. Bye. Have a good day. Bye.